All right, let's talk about an element you think you know, calcium, but we're going to go way beyond just bone health. We're diving into how calcium is the star of this incredibly high stakes, minute by minute balancing act going on inside your body, where just the slightest little misstep can cause some really dramatic problems. So let's get into the critical and often hidden role calcium plays in keeping us all going. When you hear calcium, your mind probably jumps straight to a glass of milk, a strong skeleton, and you're not wrong. But that's really just scratching the surface. The tiny amount of calcium that's actually in your blood, that's the real unsung hero, quietly managing pretty much everything from how your nerves fire to how your heart beats. Now get a load of this. The normal, healthy range for calcium in your blood is between 2.13 and 2.63 millimoles per liter. That is an incredibly narrow window, just half a unit wide. To put that in perspective, if your blood calcium was like a thermostat for your house, moving it even 1 degree off could trigger a system-wide emergency. This isn't just some guideline. It's a non-negotiable tightrope your body is walking every single second of the day. So, how in the world does the body pull off such an incredible feat? Well, it has a team of hormonal managers that are on call 24/7. It's a process called homeostasis. Let's meet the 3 key players who are running this whole show. Okay, so what's really cool here is how these 3 hormones work together like a super sophisticated thermostat. If your calcium levels start to dip, parathyroid hormone, or PTH, just springs into action. It tells your bones, hey, release some calcium, and tells your kidneys, hold on to what you've got. Vitamin D is its partner in crime, cranking up how much calcium you absorb from your food. But what if your calcium gets too high? That's when calcitonin steps in. It does the opposite, pushing calcium back into the bones and telling the kidneys it's time to get rid of the excess. It's this constant vital push and pull. So what happens when this delicate balance completely fails and your calcium levels just plummet? Well, that condition is called hypocalcemia, and what it does is it makes your nerves and your muscles dangerously overexcitable. You often see low calcium after thyroid surgery because the tiny little parathyroid glands that make PTH are right there and can get damaged. But other culprits can be things like pancreatitis or even a massive blood transfusion, because the stuff they use to store blood actually grabs onto calcium and takes it right out of circulation. You can even trigger it just by hyperventilating, which creates a state called respiratory alkalosis and messes with your blood chemistry. And this is how doctors can spot it. They look for something called tetany, which is basically involuntary muscle contractions. There's Chvostek sign, where tapping on a nerve in the face makes it twitch, or Trousseau sign, where just putting on a blood pressure cuff makes the hand spasm into a weird position. In really bad cases, this gets worse, leading to numbness, awful cramps, and even convulsions. When it gets that critical, the fix is a fast infusion of 10% calcium gluconate to get that balance back, and fast. Okay, let's flip the coin and look at the other side. What happens when there's way too much calcium floating around? This is hypercalcemia. And it does the exact opposite of what we just saw. It makes everything sluggish and less responsive. The number one culprit here is usually hyperparathyroidism, where the parathyroid gland itself just goes into overdrive. Cancers that have spread to the bones are another big one, because they can literally cause calcium to leak out into the blood. And then you have some less common causes, like certain inflammatory conditions, or the now pretty rare milk alkali syndrome from way overdoing it with calcium and antacid supplements. You gotta love this. To remember the symptoms, doctors use this classic, catchy phrase. Bones for bone pain, stones for painful kidney stones, abdominal groans for things like stomach pain and pancreatitis, and psychic moans for confusion and even depression. Fixing this is a whole different ballgame. It starts with pumping in lots of IV fluids to dilute the calcium, then using drugs like bisphosphonates to basically force that extra calcium back into the bones. And you can literally see the effects of this imbalance right on the heart's electrical activity. On an ECG, low calcium makes the QT interval longer. That means the heart's electrical system is taking too long to reset between beats, which can be pretty dangerous. High calcium does the exact opposite. It shortens the QT interval, creating its own set of problems. It's just a perfect visual of that whole push and pull balancing act we've been talking about. Okay, let's zoom in on that master controller we mentioned earlier, the parathyroid gland. When this system goes haywire, it's one of the most common reasons for all this calcium chaos. The condition is called, you guessed it, hyperparathyroidism. So here's the crucial thing. Not all hyperparathyroidism is created equal. In primary, you usually have a small benign tumor on the gland that's just pumping out way too much PTH, which leads to high calcium.
Secondary is different. It's a reaction to something else, usually chronic kidney disease. The kidneys can't do their job, calcium drops, and the parathyroid glands have to work overtime to compensate. But if that goes on for years and years, you can end up with tertiary, where the glands just go rogue and start pumping out PTH uncontrollably, no matter what the calcium level is. And this isn't just about rare diseases. This delicate calcium balance can easily be tipped by really common medications and conditions that doctors have to manage every single day. Just take diuretics, or water pills, for example. A thiazide diuretic will make your kidneys hold on to calcium. That can lead to hypercalcemia. But a loop diuretic, like furosemide, does the complete opposite. It makes you get rid of more calcium, which can cause hypocalcemia. It's a fantastic example of how these precise little mechanisms are so critical in medicine. Here's another interesting split. Dystrophic calcification is kind of like scar tissue hardening up in an old injury. It's a local problem, and it happens even when your blood calcium levels are totally normal. But metastatic calcification, that's a system-wide issue. It's what happens when you have so much extra calcium in your blood that it starts to fall out of solution, like salt from water, creating deposits in perfectly healthy tissues and causing widespread damage. So when you think about it, from muscle spasms all the way to kidney stones, all of it can stem from a tiny shift of less than 1 single millimole per liter. It really makes you appreciate the astonishing, high-stakes balancing act that's running inside of us every single moment. It's a humbling reminder of the hidden complexity that just keeps us going. Thanks for tuning in.